Once the baby is delivered, the bleeding has to stop, the placenta has to be delivered.
What are the different stages of labor and how are they defined?
But nowadays we have the painless labor option.
Welcome to an insightful session of pregnancy journey with an expert in maternal health, Dr. Pooja Shukla, a renowned gynecologist, infertility specialist at Cloud9 Hospitals, Malad, Mumbai. She will be sharing her expert insights on today's topic, stages of labor. Let's get started. Welcome, Dr. Pooja.
Thank you so much. Thank you. It's a pleasure to be here and talk about such an interesting topic of childbirth. Thank you so much.
So, doctor, what are the different stages of labor and how are they defined?
How are they defined? Wow, that's a very beautiful question. So just as we always say that just as life is a journey, pregnancy is a journey and labor is also a journey. And so life has its stages and labor has its stages. So we have 3 stages of labor. First stage, second stage and the third stage. So first stage is all about the preparation for labor. So the female body is preparing for the labor. It's just getting started. Okay. And then when it's like little revved up. So that is when the active stage of labor starts, where there is a increased intensity of pain and the baby tries to actually come down through the pelvis. So active stage ends into a delivery, and after the delivery of the baby is what follows the third stage of labor. So everything that follows after the delivery of the labor of the baby comes in the third stage of labor.
That's a great overview. Let's break it down further. What happens during the latent phase of the first stage of labor?
The latent stage is actually the first stage of labor. So every time when a patient does a sonography, they see that there is a cervix length. Throughout the pregnancy, we talk about cervix length. It is 4 centimeter, 3 centimeter. So it is this cervix that it starts shortening and thinning in the latent stage of labor. So that latent stage of labor is all about priming of the cervix. Whereas this 3 centimeter, 4 centimeter cervix starts shortening and becomes papery thin and starts opening up. So when it opens from 0 centimeter, that is closed as 0 centimeter, it opens to 1 centimeter, 2, 3, 4. So from 1 centimeter to 4 centimeter, opening of the cervix and thinning of the cervix is what is latent stage of labor. And whereas the pain intensity would slowly step up, but it would be bearable. Okay. So till 4 centimeter, it is the latent stage of labor.
So how can a mother recognize when active labor has begun?
Yes. So the very word active, so means now the baby is actively involved in the very process of labor. So as we mentioned, from 0 centimeter to 4 centimeter, it is the latent phase of labor where the lady is quite comfortable. So most of our patients who require an epidural analgesia for painless labor, so till the stage of 3-4 centimeter, they don't really ask for it. Why? Because they are quite comfortable. They can walk, they can bear the pain, they can turn around, they can bear the pain. But after 4 centimeter, the intensity of pain increases. Why? Because the baby tries to adjust its head, body. So, delivery, labor is a very beautiful process, whereas the baby entirely, so it is like angling from 12 o'clock, it will move to 2 o'clock, then 3 o'clock, then 6 o'clock. That is how it turns its head, and the baby turns inside the maternal uterus and tries to adjust into that bony pelvis. So from whenever there is that transition where the patient starts feeling that, now there is a lot of pressure in the pelvis and something is trying to come down. It's not the pushing. Pushing would happen in the last 10 centimeter, 9 centimeter. But she can feel that now the head is right there and, yes, I am actively involved in the very process of labor. So, that pain is very different. Every time a patient asks us, how will we differentiate? We said, you'll know. That's the only answer.
So what role do contractions play during the first stage of labor and how does they change over the time?
Yes. So patients always ask us, like, how are we going to differentiate that this is a labor pain or just a normal back pain? So we say, it is going to start from your back, it is going to radiate to your inner side thighs and to your uterus, and it is going to intensify with time. It is not going to be a pain that comes and goes. So it will come, it will go. After 5 minutes, it's going to come back again. So previously what used to happen, you may lie down, take a hot water bag, take a crocin, the pain is gone. But this pain will not go. After 5 minutes, the duration, it will be like for 2 seconds, 3 seconds. After again another 5-10 minutes, it will be for maybe 5 seconds, 10 seconds. So that is how we grade the contractions. We say ki they are coming, how much are they spaced out? So whether they are coming in 5 minutes, 10 minutes or 20 minutes. And when they come, they last for how long? Do they last for 10 seconds, 20 seconds, 30 seconds? So a labor pain which comes at a frequency like say 5 minutes, so kam hota jayega from 20 minutes to 10 minutes, 5 minutes to 2 minutes, 1 minute, and it will remain for a longer duration of time. Like to begin with, it may be a 20 cross 5, means it's coming every 20 minutes but lasting only 5-10 seconds. It will come in every 15 minutes, last for 20 seconds. So it will come every 5 minutes, last for around 30 seconds. Comes every 1 minute, lasts for about a minute. That is what is a strong contraction. That is how we rate the contraction.
That sound intense. So what are some techniques to manage pain and stay comfortable during labor?
Okay, so one thing is that nowadays we have the painless labor option, which is wonderful. Okay, 99% of patients who deliver these days very nicely. So we say it's a beautiful experience, whereas in the mother is not feeling the pain, yet the contraction is coming. You walk actually through labor. It is that easy, okay? But that is when the pain is when the patient is in active stage of labor, or the pain is like actually there, which is like, writhing with pain and all those kind of things. But when you say before that, what before that? That is not a 0 degree of pain. That is also on a scale of 10, it may be 4 or 3. So they can stay well hydrated. They can assume a left lateral position. There are different positions, maybe a sideway position, or maybe just holding the head and standing a little bend around, or maybe the cat and cow, or take the birthing ball, walk a little, sit on the chair, not on the bed the whole time, But that is where the catch is. You think that resting will take away the pain. Resting will not take away the pain. Mobilization is going to take away the pain. Hydration, more of motivation, have tea and coffee if you feel like, that is going to give you the pain relief.
So speaking of support, how can partners or birth companions can support during each stage of labor?
Now, that is a very nice question. You asked me about labor. I tell this to every partner in pregnancy that, you are that one pillar of support the pregnant mother can, hold on to. Be it emotional, be it physical, everything. So it's like just during pregnancy, the mother goes through a lot of emotional changes. So she may get upset, she may cry, she may feel this. So partner is supposed to be that one person whom she can hold on to. That applies during labor. Okay, during labor, during cesarean, everything, it applies. Why? Because this is one person she's looking up to. Okay, so if he can be just there, if she needs to hold your hand, clench it tight, if she needs to just vent out some anger or some frustration where she just wants to cry, if she wants to ask for something, you should be ready with a bottle, you should be ready with your hand, you should be ready there, just to give support. I've seen many people, they play songs on the phone. They talk about how they are what they are going to do after the delivery of the baby. So that sense in positive vibe. Okay, once the baby is delivered, but it's just about these 2-3 hours, and then we are going to have a baby, and then so all this creates so much of a positive vibe around the mother, rather than just saying push and no, this pain is fine, this happens to everyone. No, don't create a lot of frustration around the female. Sometimes you just have to be a good listener. That's about it.
That's so important. So moving on to the third stage, what happens during this phase and how is the placenta delivered?
Okay, yeah, so third stage of labor is also a very important crucial phase during delivery, because once the baby is delivered, the bleeding has to stop, the placenta has to be delivered. So sometimes that stage gets a little complicated where the placenta is not getting delivered. So we doctors have to be very active in that stage of labor. So we want that within 5 minutes the placenta should be out. So how can a mother recognize that this is in a third stage of labor? So there is going to be something called as an after contraction, like after pain. So she is again going to feel that something is coming out and I need to push. So that is when the placenta separates, and there is a lot of bleeding which ensues as a part of separation of the placenta, but that is normal bleeding. So once the placenta delivers, other thing on our thing is that we have to make sure that the uterus is well contracted now, and now the bleeding should stop. Okay, so once that happens, then the female is through with the process of labor.
Finally, what are the key takeaways for new mothers to feel prepared for birthing?
Yeah, so birthing is a wonderful experience, as we say. So I always tell my patients that, I'm going to educate you once you're 36 weeks. I'm going to tell you what all is. So education is the most important thing. Not Google education, because that is going to really scare you out, because Google doesn't have a filter. Okay, so one whatever it is written, it is not for every person. Everything doesn't apply to everyone. Okay, so most of the women feel very scared and very, when they read all that and see all those videos. So it's not like that. It is not how it is actually shown. It will differ for one-on-one. It's different for one-on-one. So education, motivation, knowing your situation. Where do you stand? Okay, how much are the chances that you're going to deliver normal? How much are the chances that so knowing your pain threshold, that is another thing. And the family should be knowing that pain threshold. So I would say yes, education, motivation, being aware of your own situation, and discuss with your doctor before you enter the labor. That what am I expecting, what are my chances of a normal delivery, what I should be actually doing. And yes, guidance through a doctor is the most important key. So, and we have a wonderful staff to support people during labor. So there is a full team who are going to motivate you and, let you excel in that journey. Yeah.
Great. Thank you so much, Dr. Pooja, for such an
Thank you.
insightful conversation.
Thank you. It was such a pleasure to be here.
Thank you so
Thank
much.
you.
And to our listeners, if you found this helpful, be sure to share it with others and tune in for our next episode. Until then, take care and stay healthy.